Okay, so as our friends are coming back in the room, we're gonna talk about the latest device, and that's the Solaria, the CO2 laser, and how I position it in my practice. First off, I'm so excited that InMode picked this for this year. I mean, laser resurfacing, whether you look at the halos or the cool peels or the moxies or the whatever and whatever in this space, like they are coming back into favor. And as an old-time facial plastic surgeon first, before doing full body aesthetics, like I grew up on a CO2 laser, and I love my CO2 laser. Like I love my CO2 laser for resurfacing. So when InMode approached me, like it's been a minute since they told me they were gonna have this, and now to see it come to fruition is so awesome. So the fact that they brought CO2 for laser resurfacing, I mean, that is the best wavelength, the best resurfacing that you can get, hands down. Ask anyone that does laser. CO2 is the gold standard that everyone holds their lasers against. So even when it comes to, I'm not bashing any brands, because these lasers are also great, but when you think about Halo, what is the sales pitch? It's like CO2-like results. Everyone benchmarks against the CO2. It's a CO2-like result without the downtime. First off, that's probably a little oversell. If you want a CO2-like result, you just have to have downtime, but we'll talk about how you and I as providers get to select the downtime. And that's based on our treatment settings. So I can do a big, nasty CO2, or I can do like a cool peel-ish, moxie-ish, lighter one, all based on my settings, all with the same CO2, and I'll show you examples of that. So we kind of have it all under one stop shop for our CO2 laser. So this is amazing for ablative resurfacing. So contrast that to Morpheus. Now Morpheus is pins, needles, that goes in the skin, non-ablative. They are silicone coated, so they go in the skin and you get very little lateral dispersion with your Morpheus. So that's going through the epidermis into the deeper layers, and you don't get much lateral dispersion with your Morpheus. Now we do have a Morpheus resurfacing tip. Again, we'll talk about all this tomorrow. We have a Morpheus resurfacing tip, and I have kind of a continuum in my practice from non-ablative to ablative. And within ablative, I've got like my light chemical peels, if I want to ablate the skin and resurface, you can even, if you wanted to, throw in like mechanical dermabrasion and things like that, light chemical peels, Morpheus resurfacing tip, CO2 laser. So it all has a place. And what it depends on, you as a provider, what it depends on for you when you're counseling your patients is downtime availability and expected result. With lasering, when you're resurfacing, a lot of times you can't give them everything they want if they have a limited downtime. That's where you have to do this dance with them. Just recognize it's a very linear relationship. The more downtime you're willing to accept, the more result I can give you, period. So if you got 7 days, I can do a 7-day downtime. That'll be an awesome one. If you only got 3 days, hey, let's back the laser down. We can do cool peel-like, moxie-like, back down the CO2, 3-day downtime, but I can't ablate or resurface nearly as much, and that just makes sense. And when you explain it like that, it makes sense to your patient.